Hello everyone. Today our topic will be on hypertension. What is hypertension? And hypertension is when the force of the blood against the blood vessel is consistently too high. And normal blood pressure, when you have the blood pressure less than 120 by 80 millimercury, and to define hypertension, to say that you have hypertension when the blood pressure is equal or more than 100, more than 130 by 80, especially in high risk patients. And when we say high risk patient, these are the patient who has the risk factor for cardiovascular disease, patient with diabetes, patient who is obese, and patient also with high cholesterol level. And for why hypertension is dangerous, because untreated high blood pressure, it may damage the organ over the time and may cause stroke, heart attack, heart failure, kidney failure, vision loss, and also we have peripheral arterial disease. So what we should know about hypertension is that hypertension is a silent killer, because many people they may not present with symptoms, they may present with complication, and that's why we say it is a silent killer. So what are the common symptoms of hypertension when the patient presents? So most people who has hypertension, they don't have the symptom, but some may experience headache, dizziness, blurred vision, chest pain, shortness of breath, and also some may have nose bleed. So symptoms usually appear when the blood pressure is very high and the complication develop. What are the risk factors for hypertension? We have non-modifiable. These are the risk factors which we cannot modify them, mean we can't do anything about it. So we have family history, we have patient age above 45 years, we have male gender, and the other risk factors are modifiable. We can modify them, like excess salt intake, obesity, lack of exercise, smoking, excess alcohol, stress, and high cholesterol, and also the diabetes. So this one we call them modifiable risk factor. So how to manage hypertension? Management of hypertension, the most important thing is lifestyle modification, and this is the first line management that your doctor should tell you about. So this change in the lifestyle, reduce the blood pressure, and also prevent the complication. So you have to reduce the salt intake. The other thing also, you need to eat a healthy diet, in which we call them Dutch diet, DASH diet. And this type of diet, it has to contain fruits, vegetable, legumes, and all grains. And you have to reduce also the red meat, fatty food, and also the fried food. And you can use also healthy oils like olive oil and also sunflower oil. And the other thing is also part of lifestyle modification is regular physical activity. And regular physical activity means you need to do exercise, you can walk, you can run, and also you can have gym. And the recommended time for exercise it's like 30 minutes of moderate exercise, like for example walking and also cycling. And you can do it 30 minutes in a day or 5 days per week. And this one help to control the weight and also reduce the blood pressure. Studies have shown that the more you reduce the weight, also the more you reduce the blood pressure. The third one is weight control. You have to maintain your body mass index in between 18.5 to 24.9, and even 5 to 10% weight loss reduce the blood pressure significantly. So weight reduction is very important measures in hypertension control. If you are smoking, then you need to quit the smoking. This one, when you quit the smoking, you reduce the risk of stroke and also heart attack immediately. You have to limit alcohol intake, especially the advisable for men, 2 or less than 2 drinks per day of alcohol is recommended for men, and for women 1 or less than 1 drink per day. And the other lifestyle modification is stress management. You need to relax, have deep breathing, adequate sleeping, avoid conflict and stressful environment when possible. So if you do these things, then you reduce the blood pressure. Medication adherence is also important. If you are diagnosed with hypertension, then you need to adhere to your medication. You need to take the medication on time, and also the doses that recommended by the doctor. And then also you need to have visits. And the last point, at least you need to check your blood pressure at least once a month, and keep the blood pressure record, and also report the high blood pressure recording. So when to seek urgent care? To seek urgent care if you have high blood pressure equal or more than 180 by 120, and you have severe headache, chest pain, shortness of breath, weakness on the one side of the body, immediately you need to visit your hospital for the care. Okay, so at last, in conclusion, hypertension is preventable, treatable, and controllable disease. At this point, thank you for the listening, and I hope this session was helpful to you. Thank you, and have